Happy and Healthy.
This is a new series aimed at providing older adults with resources on health, fitness, finances, and other services.
Happy and Healthy.
Welcome to another edition of Happy and Healthy, a series that's devoted to providing resources to older adults and their families. Today we're going to be talking about avoiding falls, and we fortunately have some great people with us to cover that topic. I'm Louise Thompson. I'm the Executive Director of Tampa Bay Community Network, where you can come and take video production training, and you can learn to have a TV show and have one just like this on any topic that you'd like. Let's welcome Brenda Ruehl, who is the Executive Director of Reliance, Inc., which is the Center for Independent Living. Welcome, Brenda. Glad you're back.
Thank you.
We have with us also Robin Watt, who's a volunteer EMT and fall prevention manager at the Sun City Center Emergency Squad.
Thank you for inviting me.
Welcome to you. Dr. Robert Hauser, who's a MD and director at the USF Health, Byrd, Parkinson's Disease and Movement Disorders Center. And if any of you watch the show regularly, you know USF likes a lot of words in their titles, but welcome, Dr. Hauser.
Thank you.
Appreciate that you're here. I'm going to ask if each of you will go around and talk about your agency or the group that you belong to and give us a little bit of information about that history, mission, services, clients.
Reliance is the federally designated Center for Independent Living. We serve Hillsborough County. We serve any person with a disability. It can be a disability they were born with or one they acquired. And that could be through an illness, a car accident, even cancer. We serve people who are generally poor. We're a last resort agency, serving a number of areas, including barrier removal, training with mobility equipment, and whatever is necessary to keep a person living in their home, accessing their home and their community safely.
Such a great thing, because everybody wants to stay home if
Absolutely.
they can do it and not be in a hospital environment. Robin, tell us about EMT work in Sun City.
Absolutely. The Sun City Center Emergency Squad is about 50 years old. It is the largest all-volunteer emergency services organization. We provide basic life support services in Sun City Center, and we work with Hillsborough County Fire Rescue on nearly every call they go on. Our fall prevention efforts have been in the last few years because we found that at least 30 to 33% of our calls are for people that have fallen. Sun City Center is a senior community, so the vast majority of the residents are over 65, and we serve sometimes a very frail population. And it's free to the residents there, and it's a wonderful service. And their mission is neighbors helping neighbors.
How do you get your funding if you're just all
The funding
volunteer?
is largely through community donations and grants.
Fabulous. That's great. Dr. Hauser, tell us about Byrd and the department that you work in.
Sure. Well, I'm at the USF Parkinson's Disease and Movement Disorders Center. And what we do is provide evaluation and care for patients who have movement disorders. The primary movement disorder is Parkinson's disease, but we see other kinds of movement disorders. Tremors, which is shaking, dystonia, which is unusual twisting movements. So we'll see these patients, try to determine what they have, and try to delineate the best options to provide benefit with medications or surgery. And as part of our mission, we do a lot of clinical research with patients to try and develop better, newer treatments to get better outcomes, particularly over the long term. How do we slow down progressive degenerative diseases? How do we get better outcomes in Parkinson's disease, not just early on, but over the long term, over 10 years, 20 years?
So the folks that you're seeing, there's a tendency that they may fall over people without some of these disorders, correct?
Yes, absolutely. It depends very much on the disorder. People with Parkinson's disease tend to get balance problems, one of the main causes of falls, usually 8, 9, 10 years out. So if I see a person who has something like Parkinson's disease with a little bit of slowness and stiffness, but if they have falls in that first, second, or third year, I think of what I call the cousins of Parkinson's disease. And these are known as the atypical Parkinsonisms. They have various names which I won't bother you with, but the characteristics of some of those disorders are balance problems right from the beginning. So again, experts can look at people with those kinds of problems and try to figure out what is the disorder. And one of the keys is, when does a balance problem or fall problem occur in that disorder?
Robin, you talked before we started the show about the various talks you do in the community, and you cover balance and some other things. Could you?
Certainly. We cover balance, managing medications, staying hydrated, wearing the appropriate shoes. Obviously, high heels for ladies as they get older is often a balance problem by itself. And then, of course, removing clutter, because we often see hoarders, and we have difficulty when we go to a fall call getting our gurney inside someone's home many, many times because there's too much clutter. We have to start moving furniture out of the way. So those are the 5 major things that we see as being problematic and causing a lot of falls, with really balance and medications being involved in many of those as well.
Brenda, your agency will actually go and do an assessment in the home. You're giving people warning, but you'll go right in the home.
Yes, we have independent living staff that will go into a home, and usually we're doing that because the person has said they need some kind of barrier removal, and that's due to their disability. So they may need a roll-in shower, or they may need a door widening so they can get their chair through it, or they may need the roll-in shower because they can no longer safely step into a tub. So one of the things the staff does when they go into the home is they look and see, you know, as was just mentioned, is there a lot of clutter? Because if there's clutter, it's very difficult for a wheelchair or a walker or a person who's using a white cane or a regular cane to really ambulate throughout their home safely. And the same thing with coming in and out of their home, because remember, we want to keep people living in their homes and accessing the community safely. And so we want to look at, you know, how do they get in and out of their homes? Are those steps safe? Do they need a ramp? Do they need a handrail to hold on to? And it's really working with the individual to see what kinds of things can they do in their environment that will enable them to be safe in that environment. We also look at, you know, is their equipment in good shape? Walkers. You know, 4-wheeled walkers are great unless one wheel isn't working. And the same thing with canes. Do they have a tip on them? And is the wheelchair working properly so that the person can use it safely? So it's really, you know, setting up their home in a way where it's safe, and also using their equipment appropriately and making it safe, and teaching consumers how to do that.
Robin, you said that you're down in Sun City, aging population. 35% of your calls are...
So far this year, it's exactly 32.9% of our calls have been for people that have fallen.
And what do you see having caused those falls? Or have you seen other
You know, one of the
you might want
things
to
I
add to
do
what
is...
Brenda?
I will, absolutely. We see a lot of problems with furniture. Balance, though, and being over-medicated is a large part of those problems. Often because they're over-medicated, their balance is bad. One of the things we suggest is that they keep a list of their medications. They take it to their doctor whenever they see their doctor and ask them, do I still need this? Can I reduce the dosage? Or to use a pill tray if they're not already using a pill tray to better manage their medications. Or have their prescriptions printed with large labels. And the other thing is, anytime they see the pharmacist, they should have the doctor, the pharmacist actually review their list and see if there are any interaction problems between medications. And they can do that very easily, all pharmacists.
Do you think some of it is, I know myself, I have to take a particular medication. I can't remember, did I take it or didn't I take it?
I think that's often a problem when we see someone...
How does somebody fix that? Because I can't seem to get it in my head. Well, okay, if I take this medication, I'm going to move it over to here, from here, then I'll know I took it.
Right.
But that doesn't always work out because I'm not so sure. Did I move that yesterday or did I move it back?
Do it today. Exactly.
Yeah.
Medication
do they have
trays
ideas?
can help. Usually, if they're at that point, they can't remember whether they took their medication today.
Uh-oh, where am I going?
Then they may need a caregiver or...
Well, medication trays do help a lot. So if you
They
lay
do.
them out, if it's one pill a
Right.
day and you set out your pills for the week, that's often helpful. So if you've taken the Wednesday pill and it's not there when you say, oh, did I take it or not, you know not to take another one. So those can help, even for people with good memories. So.
Okay.
Right.
Now, you talked about there being actually a study going on about medication working to help people that are off, that their balance may be off. Is that correct?
Yeah, I'll tell you what, just before I get into that, I want to add to what the lady said here. You know, we see a lot of patients, and I mentioned that we try to figure out what do the falls tell us about the diagnosis, but the other part of it is we try to figure out what are the falls due to. So when we see the patients in the office, we listen to the story, and I'll be asking, well, what are the circumstances under which you fall? Is it a trip? Are you tripping on something? Do you feel like your legs are weak? Do you get lightheaded when you get up, and is that what's leading to the falls? In Parkinson's disease, patients often take little steps and they have trouble lifting their legs up, so they may say, geez, my foot gets caught on the floor, or I trip on the rug, for example.
So they're dragging their feet, in other words, not lifting.
They may drag their feet, and that might lead to a fall. Or they may say, I can't take big enough steps to catch my balance, and it's not really a balance problem, and so they can't keep up with their center of balance. And I might use medications to help them move better in that case. And I know in that case, I may be able to help them prevent falls just with regular Parkinson's disease medications, if they have Parkinson's disease. Also, if they say they get lightheaded when they get up, I'll check their blood pressures lying down and standing up. If their blood pressure is falling, that's a pretty good clue that I need to address my therapy to the fall in the blood pressure. And then if it's really a balance problem, I have patients stand, ask them to regain their balance as I sort of displace their body backward and see if they can catch themselves. If they really have a balance problem, they may sort of tumble backward, and I'm there to catch them. But again, that's part of trying to discern which of these problems might they have that's really causing the fall. And so we're trying to separate out those different kinds of neurologic or physiologic reasons for a fall. So I think it's very important as we try to think about these things.
I once read that some people my age, older, have fallen and then a bone's broken, and so now they're hospitalized, and this doesn't keep them independent living as you want to do. But I've read that sometimes the bone breaking is what caused the fall, that it was maybe, is this correct?
Yes. Often the bone breaks first, and particularly for women. And I understand that men, once they're over the age of 85, also suffer from the same sort of incidence of osteoporosis and thinning bones, so that they are just as likely to fall from a bone break, and then they fall.
Are you treating people, providing services to people where this has happened to?
We've seen some people like that. What usually happens is the person falls, they go into the hospital, and they go to rehab, and then they go to the nursing home, and then we work with them to try to get them back into their home where they can live safely. And again, a lot of times it's making sure that, just simple things like, not having throw rugs, which look nice.
Throw rugs, yeah,
throw
that's
rugs
a danger, isn't it?
They're never good. Also, don't leave your shoes setting in the middle of the floor, or if you're, reading a magazine, don't put it down. And so a lot of it is actually retraining how a person lives their life, because they've always done it and nothing ever happened, but now they have some at-risk factors, and they're probably on some pain medication, and maybe some other medication. So it's really trying, as Dr. Hauser said, trying to look, what is actually going on. It isn't just that they fell, what caused it, what does the environment look like, what's their health condition look like, and how can they best respond to that.
And you try to get into that, even though that's really, you're just there to take care of what's happening at that very moment in time. Right. Get them to the hospital,
right. If there are any
get
injuries,
them dealt with.
Absolutely. When we respond to a fall call, one of the things we want to know is, why do you think you fell? Were you dizzy? Did you just lose your balance, or did you trip over something? Most of the time we're hearing, I don't know, I just found myself on the floor, or I lost my balance, or I just started taking a new medication, and those are probably the top three that I hear on a regular basis. So
and maybe it's interacting with an old medication,
it
or
might
another
be
one,
interacting with an old one, but then our job is to assess whether they've broken anything. If they have, to get them to the hospital. Most of the time, if they're uninjured, they don't want to go, but we always advise them to check with their doctors to make sure that they can review those medications and find out what's going on.
I don't think medications are reviewed that much anymore, or is it, I don't know if it's the chain pharmacies, or does anybody
mail order
think
pharmacies
it's all,
sometimes.
Or going to different pharmacies and mail
Shopping
order,
because
you get those calls, oh, I see you're on this drug, so why don't I supply you, 2 months worth instead of you having to go to the store. You're right, you're getting the call. It's not like you even are looking for them. So how can, I guess what you're saying is at least go into a pharmacist even if you didn't get the drugs from them, or make the list, bring it into the doctor, say, am I still doing okay? Because I know there's some websites you can go to. Discover Health has one where you can even put in generic or over-the-counter drugs and your drug prescriptions, and then it comes back and it tells you, don't drink grapefruit juice with that, or
Right.
or don't take these two together, take them at a different
Right.
time, or like that, right?
Right.
But otherwise, how are you going to know? Especially if you live alone and nobody's seeing a reaction.
It is difficult for NOAA, especially for seniors that do live alone and don't have a caregiver to assist them. We always suggest they talk to a neighbor, a close friend, if they don't have a family member, to assist them with those things. But when they see the doctor, make sure they still need all of those medications. They may not need some of them anymore. Or could they reduce the dosage on some of those medications?
Brenda, outside of, if somebody becomes a client of Self-Reliance Inc., they call you up, and then you do have, they have to meet some criteria for you to go to their homes, right?
Well, they don't have to meet any criteria for us to go to the home. They just have to call with a service need and have a disability. When it comes to our barrier removal, which is how we modify the environment, we have grants through the City of Tampa Community Development and Hillsborough County Affordable Housing, and they do have to meet income and asset guidelines for those. But in terms of our other services, our staff, that's our job. They go into the home and look and see what kind of modifications do we need to meet. Sometimes it's just moving that furniture, getting those throw rugs out of the out of the floors. Sometimes people who use a manual wheelchair, like to just kind of bound out of those chairs because they can, and they shouldn't do that. And so it's working with the individual to say, is this chair the right chair for you? And some people in a wheelchair also need a walker, because when they stand, they need that to gain that balance. And so really making sure they have the equipment, they're using it the proper way, and that it's in good repair, which is a key service that our agency provides, in that not only do we help provide the equipment, we have an equipment recycle program, but also if they need a new wheel on their walker or they need a new tip for the cane, we can do those types of things.
If someone doesn't fit in the income guidelines, is there one where they can buy some of this from your agency, or
Well,
not really? You hold on to that.
They wouldn't buy it from our agency, but we would refer them to a durable medical equipment provider. And the other thing we do for even people who don't qualify for our services, if they have Medicare or a third-party insurance company, we help process that so that they can get their carrier to pay for that piece of equipment. And sometimes that's going to be a long process. We may loan them a piece of equipment in the meantime. But we look at the individual and say, what do they need? Different people need different things. And the system, there's a lot of services out there, but it can be difficult to kind of navigate your way through. And so we help connect people to other resources. We refer a lot of people to Seniors in Service because they have a lot of programs that seniors can take advantage of. And also people with disabilities, what are some other resources that we might not provide or they might not be aware of? So it's really making those connections.
Under certain circumstances where you don't fit into the guideline thing, you might say, well, all right, now that I know I've gone to this speech, I've listened to this, how do I find somebody to put the bars in my bathroom?
The grab bars.
Grab bars, as they're called. And they could call you and get some
Absolutely.
of
Absolutely. We do a lot. Grab bars is probably one of our top 10 services that we provide because it is such a safety issue and it keeps people from falling. It also helps them to take care of their personal needs so that they can remain in the home. We do a lot of grab bars.
How do you deal with when you find that people need some of these services who have some of they've been assessed with Parkinson's or one of these related diseases?
Yeah, if it's those kinds of things, we do have a social worker who's part of our team, and she's connected to the kinds of services that we've been talking about, so she makes those referrals. It's very convenient. Yeah.
Okay. And so you don't have somebody go in their home exactly?
No, not ourselves, no.
You discuss that with the patient and tell them what they might need and so forth. Yeah. And you help them make a list, too, of what they might need.
Absolutely. We have all kinds of documents we can give them that provide information about what they might need to remain safer in their home. We have some checklists on home safety and things such as don't use the towel bar as a grab bar because it's not as secure as a grab bar is in the shower.
Oh,
I would
sure
also
enough.
like to add that Sun City Emergency Squad has loaner equipment for residents down there. We have wheelchairs and we have some walkers that we will loan out for people that need them temporarily as well.
Until
So,
they can get that
So-
all processed?
right.
That's pretty good that they can do that. If you had to give a list of different advice you would have for the viewers of what they should check for, besides what you just talked about, check your medications, check for throw out the throw rugs, these kinds of things, what are some other things that you might add to that?
I think the one thing that I would add is that oftentimes people may begin to experience something and they just kind of put it off. You know, it's not, maybe they feel a little unsteady or maybe they're tripping. And so they wait till they have a really serious problem. So they really should be talking to, if they have family members that live with them or friends or their doctor, and not wait until it's a real serious problem before they seek help. Because we find that people do that a lot.
Dr. Hauser's nodding like
Yeah.
crazy.
This is an excellent point. Near falls are a huge predictor of falls. So people who have near falls need to seek help, find out what the issues are and how to modify either the environment, their medications, or whatever is going on to prevent falls. So that really is a key message. Near falls are very important.
I found it interesting, you're just reminding me that one day I came home and my mother, I watched my mother say goodnight and was going to her room, walked down the hall, and held on. And I said, what are you doing? Why are you holding on? Oh, leave me alone. She said, I'm just tired. I said, but you don't usually hold on. Why are you holding on? I'm just tired. Just leave me alone. And she went off to bed. And in the morning, she did it again. And I said, okay, now it's time to put your shoes on because we're going to the hospital. And she'd had a mini stroke. But she had no notion of that. It was just, you know, and then pretty soon falls, of course, followed. And as you said, you brush it off. You just, you think, well, okay, well, I'm just tired. That's where she was with it. Nothing's happening. I'm just a little tired.
Right.
So,
Well, a good example of don't leave it up to the patient as well. The family needs to be observant, and if a person is in that kind of potential harm, seek help, seek evaluation.
yeah. But you don't know it sometimes. I mean, if she weren't living with me, who would have known this,
Right.
you know, ahead of time?
Right, but just as you suggested, a lot of times it's ignored. So if you see a family member who needs to hold on to the walls to prevent the fall, get the evaluation. Don't wait until a person's actually fallen, because then they've taken on that risk.
Okay. Let's go back to the last few minutes that we have. Any other suggestions you might have that you're on your checklist, for example,
One of the
Robin?
things
I
that
don't
we
know.
really promote is that if you're not already active, become active. That inactivity leads to a slow decline, and the less you do, the less you can do. That they should check with their doctor about if they can exercise, to start an exercise program. Programs like Tai Chi are excellent for improving someone's balance. Yoga, there's a program called Silver Sneakers. There are all kinds of sit and get fit programs they can watch on TV at home that are excellent ways to improve their overall physical health, which will in turn help their balance as well. But if they're not already active, get active.
Because for sure you wouldn't be able to grab yourself or something
Right.
before
if
you
you
fell.
started to fall. Right.
Okay. You had some suggestions too, Dr. Hauser?
Well, just with my last couple seconds, I'll just say we just finished a study in Parkinson's disease patients who experience lightheadedness when they get up with a medication called droxidopa that raises blood pressure. And one of the things that we found was that it reduced falls, and in fact, it didn't correlate with reducing the drop in blood pressure. So we're very excited that maybe we've stumbled onto a medication that might reduce falls through another mechanism. So we're planning more research to look into this medication and see if we can understand how it might reduce falls, and maybe it will be applicable outside of Parkinson's disease to do that as well. So stay tuned.
What was its original purpose?
To try and increase blood pressure, to try and help those patients who, when they stand up, their blood pressure falls, to prevent that fall in blood pressure, because those patients are at risk of falls from that fall in blood pressure. But in those patients, even when it didn't reduce that fall in blood pressure, it still seemed to reduce actual falls to the ground. So maybe there's another mechanism by which it prevents
And when your
falls
blood
to the ground.
pressure is lower, you could be dizzier.
Yeah.
Or not
Absolutely.
Exactly. So it
Yes.
was really tested to prevent dizziness and reduce dizziness, which it did in this population. But even in patients in whom it didn't improve dizziness, it still prevented falls. So let's look at it and see if we can understand how it did that. And maybe it will be applicable outside of that population of Parkinson's disease patients with dizziness. So let's look at it.
But there are medications for dizziness as well, but it depends on the actual source of the dizziness, correct?
Exactly.
So
Exactly.
this just happens to work well for some other benefit for the
Right.
Parkinson patient.
Well, sort of, but remember the real thing is if it can really prevent falls, that would be big. Because right now we don't have anything that can prevent falls. Maybe it helps people move better, maybe it improves balance. We don't have anything that really improves balance right now. So potentially this could be a big deal, but it's preliminary information, so I don't want to get too excited. But so far it's very, very interesting.
Did you want to add to the list? You look like you were
No,
nodding
no,
too.
no,
You
no.
didn't?
I think it's
Okay.
great anytime that there's research that's working towards, decreasing people become injured and more disabled.
Thank you. I appreciate all of you being here and the work that you're doing to help us all get around. I think you forgot to mention the one I have told myself, do not get on a ladder, I don't care what. You will wait until your son shows up to change that air conditioning filter that's in the ceiling for some stupid reason. Or, change the one of those very high up light bulbs or something like that. I don't feel as comfortable anymore. And so ladders, don't get on those little ladders anymore.
Ask for help.
Ask for help. That's what I
Ask for
do.
help.
Yeah.
Yeah. When you want me to babysit those grandchildren again, come up here and change
That's
my
right.
filter and do it right away. So I appreciate very much all of what you're doing and that you brought to us such great information for our viewers. And I hope that they tune in next time for Happy and Healthy. Thank you for tuning in this time. We'll see you next time.
Whew, getting health information is a nightmare.
It's all in how you look at it. To you, it's a pile of books, reading until your eyes drop out. But to me, I go straight to NIHseniorhealth.gov, click on what I want, and boom, there it is.
NIHseniorhealth.gov, the medical website created with older adults in mind by the National Institutes of Health.
Getting health information at our age is tough.
Yeah, it's all how you look at it. To you, it's a pile of books and reading till your eyes drop out. But me, I go to NIHseniorhealth.gov, click on what I want, and bingo, there it is.
Well, thanks for the tip.
NIHseniorhealth.gov. It's easy to use. You can make the text bigger, make the contrast better, even make it talk to you. If only everything else out there were senior friendly. NIHseniorhealth.gov, built with you in mind.